Bismillahirrahmanirrahim. So today I will talk about the ESR, that is the erythrocyte sedimentation rate. And there is a lot of confusion when you see a raised ESR, whether it is true raised ESR or there is some technical problem. So we must know about the technical problem behind the raised ESR. So what is ESR? This is actually erythrocyte sedimentation rate. Erythrocyte means RBC. Sedimentation means the settling down of RBC, and rate means we take ratio with time. Let's suppose this is a tube, and we take the blood in both the tube, and we study both the tubes after 1 hour, and this is the settling down of RBC in 1 hour. So which one has high ESR, this tube or this tube? The settling down of RBC. If the RBC settled down faster, it means that the ESR will be high. If the RBC settled down slower, it means the ESR will be low. Now if you compare both the tube, it means the RBC over here, they are settled down faster as compared to this one. So this one has a high ESR. We take the measurements from about to down, from top to bottom. So this one has high ESR because the RBC has traveled more distance in the same time as compared to this one. Now coming toward the basic concept, that is the RBC is having negative charge. So one RBC repels the another RBC. But there are proteins in the blood which are having positive charges. So what does this protein do? They neutralizes these negative charges. When these negative charges on the RBC are neutralized by the protein in the blood, what happens? The RBC, they combine together and they form a stake. That stake is called Rolex formation. So that charge is neutralized. Normally RBC repel each other. These are actually the proteins which neutralizes the charges, and after which the RBC becomes sticky and they stick to one another, and then they fall down in a tube. So we are having three categories: mild elevation of ESR, moderate elevation of ESR, and severe elevation of ESR. But this is corrected ESR according to the age, according to anemia. We must address these two factors. And I see a lot of patients that are mismanaged just based on the increased ESR. Well, they have not exclude the age factor, they have not exclude the anemia factor. A patient is having HB of 8 and the ESR of 40. That is not true raised ESR. That is actually false elevation in the ESR due to anemia. So in mild elevation, less than 40 is a mild elevation, but that is corrected ESR. Corrected ESR mean exclude these things, apply these two formulas. Moderate elevation in ESR mean 40 to 60, and severe mean more than 60. So age is a risk factor for increase in ESR. As the person ages, the ESR increases. This is multifactorial, but it is said there is a tendency toward anemia. So how do you correct? For age divided by 2, this is for males. This correction is for males, and this correction formula is for females. Age plus 10 divided by 2. Age plus 10 divided by 2. So this can be the expected ESR. So what does it mean? It means a patient is having a male patient is 100 years old. A male patient, he is 100 years old. What is the expected ESR in this patient? 50. 50. So if in a male patient of 100 year, if the ESR is 50, it means this is normal for him. This is normal for him. For the anemia, 1 gram decrease in the hemoglobin increases ESR by 10. Now this is very important. Let's suppose, for example, a patient is having hemoglobin of 8. Now this 8 is decreased from how much? From the standard. Let's suppose the standard is 13 and the patient is having 8 hemoglobin. It means 9, 10, 11, 12, 13. So he is having 5 points drop in the hemoglobin, and 1 drop increases the ESR by 10. So 50. You have to keep this thing in mind. If the hemoglobin is decreased by 5, the ESR will increase by 50. That is a very big number, and you should not take these figures for inflammation. You should not take these figures for inflammation. This is the expected increase in the ESR. The expected increase in ESR, this is not inflammation. So do not start this patient on steroids or NSAIDs. This is not inflammation. This is according to anemia. In the OPD setting or on the in the ward, we see a lot of patients, and the doctors are advising the wrong investigations. They are going after the inflammatory markers, and of course you have to confirm with the inflammatory markers also, but you have to keep this thing in mind that anemia causes raised ESR. Coming toward the serum albumin. Now the albumin has negative charge, and the RBC also has negative charge. So albumin repels RBC. If the albumin repels the RBC, it means the RBC settling does not happen. If the albumin repels RBC, the RBC cannot settle down. If the RBC cannot settle down, it means the ESR will be high. What is the ESR? Settling down of RBC. If RBC cannot settle down due to the repelling action of albumin, so the ESR will be low. So increase in albumin causes decrease in ESR, and decrease in albumin causes increase in ESR. If the serum albumin is decreased, let's for example the patient is having CLD and serum albumin is decreased, so the ESR will be increased. Till now we are not having a corrected formula for serum albumin, but the two most common which I have discussed, we must apply these two things: an expected increase in the ESR according to the age and according to the anemia. But in exam they do ask for albumin, and if the plasma proteins other than albumin are raised, they causes the neutralization of these charges and they increases the ESR. It is only the serum albumin that has inverse relation with the ESR. With this is part 1 for ESR. For part 2 we will discuss in another.